Hello friends, this is Dr. Obesity and we are in the month of September and it is unlocking right now. Uh, After this COVID pandemic, in this COVID pandemic situation, uh, unlocking has begun. People are trying to return to their normal lives with precautions itself. What we are going to discuss today, September is also the month of PCOD prevention. So, before that, before knowing what we are preventing, let's know some things about PCOD. Uh, what is PCOD? PCOD or PCOS, as it was previously known, is a hormonal disorder and it affects almost 1 out of 10 women in today's time. And it refers to a condition when there is a hormonal changes in hormonal imbalances rather in women, uh, which has resulted to form small cysts in the ovaries. So PCOD, the full form, it is a short form of polycystic ovarian disease or polycystic ovarian syndrome, as in PCOS. This hormonal disorder is a result of lifestyle disorder, some environmental factors, and a very interesting fact that it has also got something to do with the psychological background of each and every individual who are facing it. So we will try to discuss few points about PCOD. What are the signs? How can we treat it? What can we give as a management? And lastly, I will discuss a recent case of mine of an endometriotic cyst. So let's begin. So we are going to start with PCOD and homeopathy, and let's begin. So, what is PCOD? As we said, it is a very common lifestyle disorder in girls today, and uh, is a basically a hormonal disorder that is affecting almost 1 out of 10 women, and it refers to a condition when a woman has a number of small cysts in the ovaries, which is developed because of certain hormonal imbalances. So before understanding PCOD, let's understand a few things about PCOD, how the normal menstrual cycle takes place. So whenever we are talking about normal menstruation cycle, it is generally dependent on the HPO axis. H stands for hypothalamus, P stands for pituitary, and O stands for ovary. So whenever there is a disturbance in this HPO axis, it causes certain problems in the body. Hypothalamus secretes GnRH hormones, which in turn stimulates the anterior pituitary to produce FSH and LH. This FSH and LH are gonadotrophic hormones, which stimulates the gonads. In females, this is the ovaries. So GnRH hormone is basically gonadotrophin releasing hormone, which is secreted by the hypothalamus, and it stimulates the anterior pituitary, which is the master of all endocrine glands, to produce two hormones, that is FSH and LH. FSH is follicle stimulating hormone and LH is luteinizing hormone, which is in turn stimulates the gonads, that is the ovaries, to produce estrogen and progesterone. In certain cases, whenever there's a excess in FSH and LH secretions by the ovaries, what it does, it causes an imbalance in the hormonal system. This imbalance again stimulates the hypothalamus to produce more GnRH, which in turn stimulates the anterior pituitary. And due to this excessive stimulation, what happens is that there is a difference in production of FSH and LH. There's increased LH hormones but decreased FSH hormones, which causes problems in ovulation process, and thus it on a long-term basis forms different kinds of cysts in the ovary. That is what we were saying. This is from where the problem begins. This hormonal imbalance leads to a chain of reaction which increases androgens and also insulin, which produces certain symptoms. So let's move towards the signs and symptoms of the disease. Here is a very gist of the signs and symptoms produced by PCOD. The main I would like to first talk about are the menstrual problems, which is common in girls in suffering from PCOD. These menstrual problems generally start with any kind of amenorrhea, with it can be due to late or early menstrual cycles. It can be due to profuse flow, that is metrorrhagia, and it can be also associated with painful menses, that is dysmenorrhea. Except these, in dysmenorrhea, there's pain in abdomen, lower abdomen, to be more specific, in the back, in the thighs, and sometimes in the breast as well. There are a number of problems which can be there associated with in menstrual problems associated with PCOD. Other than menstrual problems, let's again move towards the other problems which are generally present. In mind, there can be mood disorders, there can be a depression, and there can be a lot of emotional changes in the mind of a patient who is having this problem. In the physical symptoms, what we can find objectively is that there can be an excessive hair growth, there can be excessive facial hair, which is also called hirsutism, and it can be it can lead to a development of a male husky voice, and these is a very severe changes we can see in PCOD cases, development of male like voice. But facial hair growth is very common, and in many cases also most of the girls are coming to us with this problem, that is excessive facial hair growth, and they want to get rid of it. After trying different kind of treatments, when they understand it's not getting solved, they come to doctors and understand, after certain tests they understand that they are having this problem of PCOD. With another one of the very very important symptom of PCOD is weight gaining. In many of the cases, that what happens is of PCOD, what happens is that patient tends to gain a lot of weight within a very short span of time. Now, this if we are talking about weight gain and obesity, this is kind of forms a vicious cycle with PCOD. See, whenever there is this PCOD, what it does is forms androgens, which increases and causes, or which increases weight and which causes obesity by a chain of reactions. And again, this excessive weight gain in turn again stimulates the hormonal chain reaction, which causes the PCOD, which is the cyst in the ovary, to grow more in size. So, except for this, there are certain problems like dandruff, there might be baldness, also there might be hair fall, and these in long term may also lead to infertility, that is inability to conceive. This is again one of the major reasons people are coming up when they realize that they are having a problem. Except for this, there are many cases that the patients don't have any kind of symptoms, they are having regular menses without any problem, and still they are having this PCOD problem. In most of the cases, the most very diagnosable objective symptom we can find is acanthosis nigrans. As you can see, this diagrams in the screen right now, you will see there is a dryness, roughness, and dark discoloration over the skin around the neck region. This, if we find in any particular patient with a little bit of menstrual problem, we can be almost certain that this patient is suffering from PCOD, and it is a very wonderful objective symptom to look out for. So, after discussing the signs and symptoms, let's go towards treatment. While talking about treatment in homeopathy, as we know, homeopathy does not treat the disease but the patient itself. So individualization is the main concept for homeopathic treatment, and constitution medicines works wonders in treatment of PCOD as well. So the best reason to take homeopathic treatment for these kind of problems is that it is the most safest way of treatment, because in modern medicines there are hormonal therapies which includes oral contraceptives also, which in a long-term use causes many problems to the individual, even causes problems of conceiving at a later point of time. This is where homeopathy can help a lot without causing any kind of complications and treating the disease in the most safest way possible. Some medicines which we can think of while treating PCOD, especially in the constitutional sphere, are belladonna, calcarea carb, lycopodium, lachesis, natrum, pulsatilla, sepia, thuja, medorrhinum. Don't mind sepia is mentioned twice. Belladonna, what we can think of belladonna and PCOD is that if we go for a constitutional outlook, those people are generally very charming, very happy when they are good, and very much angry, means they are furious when they are angry. This is one of the mental sphere. They are afraid of ghosts, they are afraid of darkness, and they might have a tubercular background in them. Basically, what we are talking about is that they have a tendency to catch cold. They can have a family history of tuberculosis, pneumonia, asthma. This is the general outlook we can look for. And again, calcarea carb is a complementary of belladonna. Basically, calcarea carb is the one of the constitutional remedy, and belladonna can be given as an acute of the constitutional remedy. For the acuteness of the symptoms like pain, especially dysmenorrhea, we can think of belladonna is an excellent drug. And in calcarea carb, the major symptoms is that what we can think of in a constitutional way, desire for eggs, perspiration, especially on scalp region. There's profuse perspiration. The patient is generally flabby in constitution, flabby, fatty, and this is another common symptom of PCOD, that is like weight gain and obesity. So, which is also found in calcarea carb as well. Other than that, the patient can be chilly or can be hot. In both of the cases, we can think of calcarea group of medicines. If the patient is too much hot and there's we can think of calcarea iode. And again, if the patient is very much chilly, we can think of calcarea carb. Again, moving on to the next medicine, lycopodium. Definitely, it's a very good medicine for PCOD, but generally, we should not start any chronic prescription with lycopodium. If it is required, we can definitely go for lycopodium, and just give me a minute. We can definitely think of lycopodium, and the adjoining symptoms for prescribing lycopodium is the patient is a very chilly patient. They have got gastric troubles associated with any kind of problems, that is PCOD as well. Mostly they desire for loose clothes. There's chilly patient, they desire for hot food, desire sweet, salt. They can also have an extra desire to take extra salt in their food. Then there's lachesis. We can always and main thing I forgot about lycopodium is right-sided complaint. Mostly right-sided ovary is mainly affected by PCOD. It can be also left side, but if the symptoms are indicative towards lycopodium, we can most certainly give it. And lachesis as a complementary of lycopodium, we can also think in left-sided affections. A person who talks too much, very much talkative in nature. It's not I'm saying talks too much. It's talkative in nature, desire for loose clothing, left-sided affection, and many other symptoms of lachesis if it corresponds to it. Natrum, again, if there is a history of grief, we can also start the same prescription with Ignatia. And on the second point, second prescription, we can move towards natrum. Natrum again is a very good medicine, and there can be an extra desire for salt. There's desire for bitter. There's aversion to bread. There might be a little bit constipation. There's intolerance for sun exposure. There can be urticaria. There can be perspiration more in the upper lip or in the face. Generally, these are hot patients. If a patient is chilly, and again of the natrum group, you can think of natrum. They have a very close resemblance to lycopodium in many of the aspects also. But in that, we can find desire for bitter as a standing out symptom, which gives us more towards the natrum group. Again, if we go for pulsatilla, is an excellent remedy of PCOD, especially for individuals who are having this kind of problem. Since menarche itself, it's a very calm, gentle person who has a whipping disposition, who desire for fatty food but can't tolerate it much, and very much thirstless patient. And basically, if you find a pulsatilla constitution with irregular menses, definitely as a added symptom, we can think of pulsatilla. Our next medicine is sepia. We know there's a complete indifference of using of contraceptive pills means if a patient has been given contraceptive pills or hormonal pills, for this treatment of PCOD, and after that they have come to you, you can definitely think of CPR. Thuja we can give constitutionally if symptoms of Thuja are corresponding with symptoms of the patient. We can definitely think of Thuja, and it's an excellent remedy, especially for left-sided complaints. Medurinum goes the same, with increased thirst, where there might be forgetfulness and desire for monsoon weather. Some medicines we can think of in some medicines we can think of for basically dysmenorrhea during dysmenorrhea, that is painful menses, are Simicifuga, Viburnum opulus, Macphos in decimal scale, and Jonotia ashoka in mother tincture form. Other medicines to stop profuse bleeding, we can think of Thalasspi bursa pastoris, acid gallic in potency, Ficus religiosa, and Trillium pendulum in mother tincture form. Moving on, management. As a management, weight of the patient needs to be managed with dietary restrictions, and any food rich in any estrogen should be avoided. Plenty of water should be given in order to reduce acne, and as a precaution, it is best to take foods rich in dietary fibers and less fried in nature. After this discussion, I would like to discuss a case with you which I got recently in my clinic, and this patient was actually a 34 years lady who consulted with me with pain in her throat. She came with an acute problem. She was actually consulting for her child at the same time, but she was having certain problems, that is sore throat. So she came to me and wanted to take medicine. I casually advised her to take belladonna 4 doses and 200 for 4 doses, but then she insisted that she had other problems also which she wanted to discuss. So then when I took her case, I found out that she was having an endometriotic cyst right now. She was having a chocolate cyst in her left ovary which was operated. As we can see her reports, let's see. You can see the ovary. Right ovary is enlarged in size, and endometriotic cyst of 31 mm and 20. Okay, and next we can see left ovary could not be visualized because it had been operated because of there was a chocolate cyst. So while in the first prescription, while fever, there was many problems at that time. There was a history of fever, there was a little bit of sore throat, there was headache, there was a lot. She was having a problem of sensitive teeth and also otitis problem at that time. This is not a new case. This is a follow-up case itself. And she was having hypothyroid. The first medicine which we gave was again deadly nightshade 10 mg, that is belladonna. After prescribing belladonna 200, we had gone to belladonna 10 mg. She came the next time she came. She went for I took up the whole case, and I started with belladonna 10 mg, followed by Maxwell 0/4, followed by Maxwell 0/6. And since the sore throat was there continuing, I gave up Phytolocca mother for gargling. And I have given a report also, the same report, endometriotic cyst in right ovary, 31 mm into 29 mm. LMP, I have given her LMP here. And it was very much painful on the first day, as you can see, it's written there. I also advised her to take a thyroid test. On the next visit, let's see, I took even a more detailed case taking, and at the end of it, when going through the mental symptoms, I found out that she had a tremendous anger, and she would throw things whenever she's angry. And on this basis also, I took a little bit more deeper history and found out that she had a suppressed insult in the background, for which I prescribed Staphysagia. You can see my prescription. You can see my prescription here. I started with Staphysagia 50 mg, followed by Causticum 0/4, followed by Causticum 0/6. This was my prescription on the third visit actually. And after we had follow-ups during the COVID situation itself. And after that, on 29/8, that is 29th August 2020, she had again had a USG done. And as we can see, the cyst is nowhere right now. And the endometriotic cyst has already gone. And as said, left ovariectomy status is seen, because as I told you, it was removed, it was operated because there was a chocolate cyst. So with this, actually what I want to say here is that with homeopathic medicines we can deal with a lot of problems, and especially in female problems also, it acts in a very good manner. The main part for which it is even more better is that while handling acute, that is for pain where there is too much amount of pain or there is too much amount of profuse flow, we can easily handle it with homeopathic medicines without giving them drugs of invasive in nature. Because if we think of the modern medicines, they are generally prescribing hormonal therapies, which is not as in long term has got severe side effects to the patient. So we are trying to decrease that with homeopathy, and
with this, I hope I have been able to explain you guys what is the implications of homeopathy in the treatment of polycystic ovarian diseases.
I hope this helps everyone, and I hope whenever there is a problem related to these kind of female problems over like PCOD or uterine fibroid, I'm going to again discuss this in a more detailed video in later stage of my channel. But for now, I just wanted to say that for PCOD, what we need to do is to help the individual take a more better lifestyle habits, choose better foods, and to maintain a better state of mind. This can always help an individual to develop less amount of disease. No matter what is the disease is, it has got to do with the environment and with the psychological aspects of a patient. So with this, I would like to end this video, and I hope that all of you take care of yourself and make this share this so that it can make the people more conscious about the problems which is prevalent in the world right now, and help them to know that there are what are the treatment options available also. With this, this is Dr. Chatterjee, and I hope you have a wonderful day.